So why are you getting jaw pain and what can we do about it? Well, let's talk about it. There's actually quite a few things that can cause jaw pain, but I treat it pretty frequently in my office, and there's one thing in particular that I find the most common. And that's a certain muscle that tends to be tight, sometimes spasming, sometimes having trigger points. But it's a muscle that you probably haven't heard of, and it's a muscle that you probably couldn't locate unless you've taken a few anatomy lessons. So there are four main muscles of mastication. Those are chewing muscles. There's the two that most people have heard of. There's the masseter, which is right here at the angle of the jaw, and that's responsible for biting down, among a few other things. And then there's the temporalis muscle, which is up here. So both of those are fairly commonly addressed for people who do have jaw pain. If you address those and it feels better, that was probably the problem, and you probably don't wind up in my office. Now, a lot of people go down this track and they don't find any relief, and they may try other things. They may try Botox in the masseter. Again, if the masseter wasn't the problem, unfortunately, that's not going to help. You may go to the dentist. You may have your teeth shaved down to try to bite down more evenly. You may have certain surgeries done. Sometimes these things are effective, sometimes they're not, and unfortunately, they're very invasive. So when they're not effective, you can't really just take it back. So I always like to advocate for trying the least invasive option first, and that's what I actually do with jaw pain in my office. So working on the other muscles of mastication, which are the pterygoid muscles, the medial and lateral pterygoid, requires going into the mouth. And that's why they're not worked on as frequently. It's obviously not the most fun thing to have done, but if it's done well, it's an extremely effective way to relieve tension, and it can be an absolute game changer. The other nice thing is, unlike certain conditions, jaw pain, especially if this is the problem, tends to respond very quickly to this type of care. So you're really going to know after one visit whether this is helping or not. I like to tell patients if they're not seeing 40 to 50% relief after a visit, this probably isn't the problem or isn't the entire problem, and we need to explore other avenues. So if you are having jaw pain and you are in the Ithaca area, I'd love to help. Our website and phone number will be in the description below. If you have any questions about it and you're not in the Ithaca area, I'd also love to help. Please leave us a comment, shoot us a message, and I'll get back to you as soon as I can.